My name is Jainita. I'm from Human Mechanic Physiotherapy. As promised to some of you young parents, I said I'd do a video for respiratory physio for children. Some of you in Nairobi have been waiting for this a little while, so thank you for all your patience. We're finally getting around to it. So I'm going to start off with a bit of basic biology, because many people don't even realize what physiotherapists can do for respiratory issues. And given that corona is a big part of our lives, given that children do have chest infections and catch colds really quickly, a lot of this might be useful regardless of the COVID situation. So, first things first, when it comes to the lungs, think of it like a big balloon with lots of air in it, and it's surrounded by lots of blood vessels. And normally, gravity being an issue, if you're standing like I am now, everything pulls towards the bottom of the lungs and the air is at the top of the lungs. I'm going to use this water bottle as an example. So this is all the blood, this is the air. Now this baby here, thank you to Neha and Saina for sharing their doll. We're going to use this analogy and work on this baby and see how we go. So with the lungs, as you lie down, the lungs change the way the blood is being spread throughout, and therefore the air changes. And using this concept, what we call ventilation perfusion, this is how we maximize how much air we can get into a child's lungs. So keeping this in mind, blood, air. And so as the baby turns, the oxygen, the blood, the air, it all redistributes around the lungs. Okay. So in this case, let's say your baby is lying down, okay, and this is for kind of an infant and a baby, someone that needs still a little bit of care and support, doesn't quite understand what they are doing or how they can help themselves. They should be lying down, and you can change the way they sleep. You can change the tilt, so they can either be sat up a little bit more, or they can have some, a support under their legs, so then they're kind of raised up a bit. This position, you want to be there in presence. You don't leave them there for very long, maybe about 4 or 5 minutes tops. This position, you can leave them a bit longer because actually it's safer and it's not going to affect their swallow. Now, what you do is, for children, you get a towel, a hand towel, you'll roll it, okay? And when you roll it, it's a bit like a sausage. You tuck it under the bed sheet, okay? So that what happens is, your baby, and be sure to gently handle the baby, okay? You roll them over and then you tuck the towel so it's slightly tucked under them to not allow them to roll back. What this means is that the blood comes down here and the oxygen comes up here with the air, and there is more air to this side of the lung. And if you do that and leave them in this position for half an hour or an hour while they're napping in the morning, and then in the afternoon you take the roll towel out, you put it on the other side, and then you have the same process again, okay? So as soon as I pull the roll towel, you're going to see that the baby will slowly just come back onto themselves and they're on their back. Roll towel out, okay? Now I'm going to show you from the other side over the sheet so you can see what I mean. But you want to slowly bring the baby over towards you, okay? And just tuck the rolled towel under their back so they can't actually roll off it. And as they do that, they've got that incline. Again, it brings the oxygen up with the air and it brings the blood down. And it's changing the ventilation perfusion matching that we need. So the options are flat, angled with the head up, angled with the feet up, rolled to the left or rolled to the right, depending on what works. What we normally recommend, especially if the babies or children are admitted into a respiratory situation, is we say that we keep changing position because we keep getting air all around the lung, and that's really, really important. So this is really important for sleeping issues. The other thing to do is you can set up a diffuser with a little bit of eucalyptus or peppermint or some kind of an essential oil if you feel, or if nothing else, get your child in a bathroom that you can seal off and just let some hot water run in a bucket please, and salt. Let the salty warm air get into the child's lungs. Let them just sit there, feed them in there if you have to. Yes, it's a bit of a waste of water. Yes, it's a little bit of an effort, but actually helping them breathe easy is going to give you a chance of getting them to take their milk in or eat their food better. So certainly a strong recommendation when they're really struggling because they're quite congested. If they're a little bit older, if they're at an age where they can understand enough to say, have an instruction like blow, I'll show you a couple of things that you can use as ways to kind of engage them in some respiratory strengthening stuff, okay? So your first one, okay, is just grabbing a bunch of tissues, really, really small pieces of facial tissues, so quite lightweight, okay? You put them on your hand and you ask the child to blow them away. Now I'm going to demonstrate this, okay? And so what you do is you just blow. And part of that process of blowing, what it does is it stimulates the child to taking a deep breath and blowing out. As it does that, the air that is built in, the air pressure that is built in around the lungs will squeeze any of the congestion to the major airways, like you imagine toothpaste being released out of a tube. Okay, it's the same concept, and that's what we do with these. I'll just tidy this away. If you feel like your child it's too easy for them to do that, the other option is to make little butterflies, okay? So first to show you, it looks like a butterfly. It's got a couple of wings. I'll show you another one. It's not massively good and not very creative, but there you go. And they're a little bit heavier because of the knot, and they're a little bit heavier because they're bigger. And then again. And then when they don't do it, and you get them to blow until they blow them all away. This is normally a little bit easier when your child is about, the age of understanding. So you're looking at between kind of 18 months plus till about 3-4 years old. They can do this and they can do it well. And it's a bit of a waste of tissues, but you know what? If it's going to keep your lungs strong, it's going to keep the babies from being too congested, I think it's worth the price, personally. But that's my opinion. If you're an adult or a child, you have slightly weak lungs and you're feeling congested, you can just put them in front of you and blow. And as long as you blow and try and keep it away, that is working on your lungs. I'm going to demonstrate now. You hold it in front of you and then you blow. The longer you can keep it away, the more you're making your lungs work. So, in terms of setting this up, it is literally get a facial tissue, tear it into a piece and blow at it. This is really good for the slightly elderly as well that may not quite understand some of the other respiratory physio stuff that I have gone through with some of my clients. However, this is really easy. My grandmother, who was in her 80s and didn't understand a lot of English, and I didn't speak very good Gujarati, could understand the demonstration and therefore followed doing this, and it really helped release a lot of congestion in her lungs. For young kids that are aged between 2 to 5, 2 to 4, they're congested, they're feeling a little bit grumpy, they're not breathing very well, the best thing to do is get them jumping and running as you can. As soon as they're taking those deep breaths and they're breathing in, they're taking that air in, and like I talked about that toothpaste being squeezed, a lot of the congestion comes to the major airways, and then you get a big cough and they pull everything out, okay? So some of the most important things is positioning while sleeping, sorting out some air diffusers, or spending some time in a salty watered environment, so bathroom, hot bucket, put a bit of salt in, and then using the little strategies with the tissue paper. If there is more, it's kind of strategies we kind of adapt to the individual, so it's really hard to give you a whole list of things that you can do. But what I would say is lots of movement, lots of sitting up, lots of changing position is really good. As an adult, sitting slouched means you're blocking airways. So try and sit up, support the elbows, get your shoulders up, get the air, because your lungs actually start right at the top. Get the air in. And as the air goes in, it forces the congestion to come out. I strongly, strongly recommend that you give this a go. If you have any questions or you want us to kind of teach you stuff and you want to book in a session with myself or the other physio, give us a call. on 0759838391. I can't remember the other two numbers. Or send us an email on inquiries@hmphysiotherapy.com, and we can go through the stuff with you in person, teach it with your child present, or you can come in yourself. Or if you feel like you need a bit more clarity or perhaps another live session like this, we could probably have something arranged. Thank you for joining my session, and I hope this helps you any which way possible. And like I said, any more questions, just give me a shout.